My name is Mike Zobel. I'm from Arlington, South Dakota, and I like to play golf. Not very good, but I enjoy going out, get some exercise doing it. Like to camp, like to spend time with my family. I had knee surgery, so I needed to do some therapy. I guess the reason I came to here was my son had gone to Gavin a couple of years ago or so, and we had good results from that. So my surgeon, which is Dr. Reiber, and he said I'm one of the 1% that when I get scar tissue, I get it really bad, and that affects how it'll bend. My body reacts differently to when you get that tissue cut into, and it gets really bad anytime you have a scar. The scar tissue just goes like this. It was the different exercises and the equipment that they have. It seems pretty simple, but from the tail end of the last one and the beginning of this one, the exercises that I was doing and the techniques they did are what I would consider got me going faster than I did the first time. The second time, they knew what we were looking for right away. And I was rolling right along, it was going good, and then I hit the third week and we had no progress whatsoever. Stan was who my therapist was, and he called my doctor up right away and says, I think we need to go in and manipulate it the second time with the other one too. And so I think that just from the tail end of the first one and the knowledge that we had, they were always on top of it. So you better be doing it at home too, what they're telling you, or it's going to take a lot longer. And I think they can kind of feel out whether you've done that or not. A lot of the stuff they use to do their therapy, you can relate it to something at home, so you can use it at home. Whether it's put a couple books down to, they use a board or whatever they have. You can use similar things at home to get the job done. You don't have to buy special things, or you can relate it to something, a step you have at home. And I thought that was kind of nice. There's something at home you can use to get the same result, and I think that helped. I probably was out by the time I went part-time and everything else close to 3 months on the first one, and I was back in 6 weeks on the second one on a part-time basis. So, well, it was convenient for me because I could come and go from work either before or after, and I'd come in, and there's times where if they had to reschedule, they fit me in to when it worked for me, because there was a couple times where somebody wasn't going to be there when he needed something off, and we worked back and forth together great. And if I needed to change it for half an hour, they fit me back in. And so it was a good experience that way. Oh, I would highly recommend them, because I still think that's why it went so much faster the next time. Than they were right on top of everything when, like I said, the second one going along great for 2 weeks, and then all of a sudden we hit that stretch where it doesn't do anything, and Stan was right on top, called the surgeon, and yep, we need to go in and manipulate it again. I was kind of hoping to avoid that, but then we were right back on track again. And a lot of the things they do there, that it almost looks too simple, but what they do works.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.